Hello everyone, this is Noor Zibda and you are joining me today on the Thank Gut It's Fixed show. Today's episode is going to be about what causes stomach pain and how your friend's advice might actually help. Now tell me this, has it ever happened that you were in a social environment or somewhere, you're part of a group, and one person asks a question and everyone starts to respond and you're like, oh, you're shaking your head like, no, that's not that's not right, or oh my god, you're making things worse. Now we are all experts in different things in what we do, right? So if you spend years and to get degrees and certifications and practice and you're good at one thing, that really gets you a little bit of sort of ability to kind of navigate someone or navigate a problem with someone. Now, but it becomes a problem when everyone is just talking from personal experience. So this happened last week. Now, this happened in one of the groups that I belong to on Facebook. And if you know, or if you're part of that group, please know that I have all the best intentions for people in the group and for the person who was dealing with this issue. What I really wanted to use that, it kind of inspired me because you may be in pain, you may be in suffering, and you may not be getting the answers from doctors and things like that, and your last resort is to go to friends or groups or forums to help you. But usually in these situations, people don't have the full picture. People are talking from personal experience, so what helped so and so is not necessarily going to help you, and some of the advice might actually hurt and have you like more confused, more in pain, trying all different things that don't work. As I go about this, I'm going to talk about what causes stomach pain. Number one, I'm just coming from the heart, just want to share this because if you're in the same situation, or for that person, if they watch this video, that just giving them ideas and suggestions for things to try while being respectful to other people who have done their own share of advice that may not be correct. The other thing is I want to let you know, I'm not a physician. So with this information that I'm showing, I am going to just show you some facts. This is anatomy, physiology, but it's your job to go and seek answers, and this is just educational. If I can be part of that picture, I would love for you to contact me and tell me like, oh my god, I've done all of this, can you help me? I would love that. I'll put a link for you. But if there is a serious condition, go talk to your doctor, because you cannot solve your health over Facebook videos and forums and Facebook chat groups. So are we good on this? So here's what we're going to talk. So I'm just going to share what that person, anonymous, but somebody had posted in a group that they have diverticulitis, which is an infection, which is having pouches in your intestine, in your large intestine, and then the food gets and seeds and things accumulate, waste even accumulates in these pouches, and they can get infected. And when they get infected, there's bacteria in there that can cause pain, diarrhea, vomiting, just like a lot of discomfort. Now, that was what the person said. Now, we don't know how, if that was infected or not infected. Diverticulitis means that it was infected. She had said that she had taken medications for 2 weeks before, and then the symptoms came back. She had 3 scans in the past 4 months, and they were all negative. And last comment was that she went to the ER, and they just gave her a painkiller. So we don't know the whole picture. We don't know what type of scans these were, but we know somebody is in pain and she sought help. Stomach pain can be in any, like, we say like casually stomach, but for a physician, for somebody who's trying to diagnose, they're going to know what part of the stomach is going to be the problem. Remember that your digestive tract, here it is. So here's your large intestine and the small intestine, your kidney, your gallbladder, and your stomach, your spleen, your appendix. That's a digestive system. But there's also, for women, there's your uterus, and then there's your bladder, and there are your kidneys. So it's really important to know like which part of your stomach is really hurting. And what I like to show, another picture shoulder, and depending on where your pain is. So like some of the things that, the right upper part is going to be your gallbladder. And one thing that, but not necessarily all the time, if you have a pain in your right shoulder, that can be also related to your gallbladder. Now your appendix is on the right, so down, below is the lower right quadrant is your appendix. Your uterus, your for females, your ovaries, and then you have irritable bowel syndrome can be in different parts of the body, and so it's really hard when someone says stomach pain. It's really just hard to know exactly like what it is just in a group. So that's why it's really important to go to talk to someone who knows where these organs are, like a physician or a GYN or a gastroenterologist. They know exactly what organ to look at and what part of your body is what's under the skin. So that's one important thing. Now some of the advice, or some people have mentioned, and what really is like, sometimes it's one thing when you share with someone that, well, I've tried this, but, or this is, to share your story, but it's different from saying, nope, it's not your gallbladder because so and so. And so like one person, it says, no, it's not your gallbladder, just go take an herbal tea. Well, how do you know if that's true or not? Or somebody's like, it is for sure your gallbladder. You have gallbladder stones, and my husband had this, and he had his gallbladder removed, and this is what you need to do. Also does not work. Some of the things people recommended probiotics. And while probiotics are generally a good thing, different probiotics, they're not all the same. So number one, you can take a probiotic and it will do nothing because it is maybe just one strain of bacteria or not enough dose. And you'll say, oh, probiotics don't work. Well, which type of probiotics? You might take a probiotic and it will hurt. And that's because one of the ingredients can be a problem, or that you have SIBO, a condition where you have overgrowth of bacteria, or maybe that it has ingredients that cause more fermentation. So a probiotic can hurt. A probiotic can do nothing. A probiotic can also go through your body, and it will be, all the good bacteria will be killed by the stomach acidity, and you will not benefit from that. And so, probiotics are, completely, a whole another game. Gallbladder. Now you want to get checked for your gallbladder. If the pain is in the upper right, gallbladder problems are serious. But here's one thing when you think of the gallbladder. I had one patient where her gastroenterologist didn't know what was going on, and he said, hey, let's just take out your gallbladder and see what happens. It's not the same as giving you a diet or a supplement and let's see what happens. We're going to open you up. We're going to cut you up, take an organ that is really important for digestion and for you can handle, certain vitamins and fats. Let's just take it out and let's see what happens. I don't know about you, but that does not seem like something I want to do. But, it's important to scan for the gallbladder. If you have vomiting, if you haven't had a bowel movement in a few days, if the pain is so severe that you have to rush to the ER, if you are having blood in your stool, these are signs that you do need to go see a doctor. You want to rule out, if they need to do a colonoscopy to make sure that your colon is not bleeding, you have to have that done. If they need to scan your gallbladder or to see if there is any blockage, you need to have that done. So we can't just all say, or, expect what someone has. And don't do that for yourself. A lot of times what people do, they self-diagnose. You go online and you're watching this video or that video and you're like, oh, this is exactly what I have. Sometimes I have, I can make guesses, but that's also based on doing this for 6 years, seeing hundreds of people and doing all the research and the learning. But sometimes we don't even know. We can't predict. Sometimes I think something is going to come abnormal and I'll be surprised that it is just fine. So, each person is different and the body will react differently for each person. Now, one person recommended to follow a specific autoimmune diet, and that's a good step in the right direction. But the problem is you don't really know what is the cause of it. So if the autoimmune diet works, then do you have an autoimmune condition, and what else do you need to rule for and investigate so that autoimmune condition doesn't develop or cause other ones. So it's just the first step. It's not the full or the final step. Someone else had suggested to take chamomile, anise, cumin, rose water, honey, tea, all of those different things. And while some are traditionally helpful for stomach pain and stomach issues, ginger is another one of them. Doing food sensitivity program, I know that all of those things can create more stomach pain for certain people if you have the right recipe for or the right storm for a food sensitivity to develop. So any of those can create more problems. I had a question, how about x-ray? Will that help? I'm not a physician or a radiologist, so I don't know the different types of x-rays, but you would have to talk to your doctor, and it's not like we can all just go order an x-ray on our own. But depending on the symptoms, they want to see what's inside. And sometimes like people do all these tests and they are disappointed because they're all come back negative, and you're like, man, I really wanted to have a disease so that they can find me a solution. And I hear you and I feel your pain if this is what's happening, because sometimes they do all of those tests and everything comes back negative. This is important and this is helpful because we know you don't have Crohn's disease or colitis, and you don't have blockage in your gallbladder, and we don't know that you don't have appendicitis or something like that. But I know how frustrating that can be because you're looking for a solution, an answer, and your doctor just says you have IBS. And that's like one of the things I'm passionate about. And it's so funny, when I was back in college, I thought I will never have anything to do with IBS. And now everything I do is IBS, or almost everything, 80% of the people I help. So IBS is one this big lump term that, if everything comes back negative and you're still having pain, bloating, diarrhea, constipations, your doctor don't know what to do with it. They're going to tell you you have IBS. Their recommendations are a laxative if you have constipation, and anti-diarrhea if you have diarrhea. And if you're bloated or gassy, they might prescribe you an antidepressant. So they might give you a diet sheet, and that would be a good step, but it's not enough. They might tell you to Google it. They might say just take out broccoli and beans, and all of these are just not really not going to get you to a place where you don't have your pain, where you're not in misery, you're not waking up at night. If these are what you're dealing with, you really have to look at your diet from a very whole perspective, because a diet sheet is really not going to solve the problem. And what I really, really want to, I will definitely have to talk about IBS. It needs a whole episode on its own. But IBS is irritable bowel syndrome. It's a syndrome, and the name just explains the symptom. Your bowel is irritable. It's irritated. We just need to find out what is causing it to be irritated. Is it a food sensitivity? Is it a bacterial overgrowth? Is it a problem in digestion? So just giving someone that label doesn't really help them, because you're not giving them a solution. And the solution is not going to be in your conventional doctor for IBS. I'm going to say that. If nothing is wrong with you, you just have IBS, what you really need to do is look for alternative therapies. So part of what I do is I help people figure out what are their food triggers for IBS, what else is going on in their gut, what do they need support in terms of supplements, digestive enzymes, all of those things. Are there any underlying conditions or imbalances so that they can tolerate foods and enjoy their lives and not be in pain anymore? But what I want you to know is it's solvable. A lot of times your doctor will tell you there's no cure for it. You cannot do anything about it. And this is not right. You can do anything about it. You can get rid of the pain, but you just have to, knock on different doors. Back to that original, some people had, asked, suggested to that person to get a second opinion. Absolutely agree. You have to get a second opinion. Doctors are, different experiences and different levels. Like maybe one doctor had certain cases, one rare case that made him more knowledgeable about a certain condition. So it does not hurt to get a second opinion. One person said it must be a urinary tract infection and take cranberry juice. And to that person, I say, I don't know, is it a urinary tract infection or not? Does it have all the other symptoms? Did you do a test for that? Again, we cannot diagnose through a Facebook form or just a social gathering or any of those things. A bunch of people said it's stress. It must be stress. Take life easy. And I'm sorry, guys, but I don't know. Life, it's always going to happen. There will always be things happening. And when someone tells me, take it easy, I kind of go back and ask them, well, what does that really mean to take it easy? Now, we all make decisions in our lives and what we decide to do with our time that we worry about. So I'm not going to go in there. But telling someone who is anxious about their health condition, who is not sleeping at night because they wake up in pain, who end up vomiting and not getting answers from their doctors, tell them to take it easy. I don't know if that really works. So, definitely stress is a big component, and it's good to point to stress, but there's just obviously more layers to it. And we all think of stress as our jobs, our families, deadlines, money, traffic, commuting, all those things. But stress can be internal. So your inability to digest food is a stress. A bacterial infection is a stress. Nutrient deficiencies is also a stress. So we have to look at your mind and your body from a holistic perspective. Somebody, said to not eat caffeine and tomato. While this is also not a bad suggestion, but is this the answer? Is this the solution? That is what I really wanted to share with you today. If you know where your pain is, you can kind of, like, is this my liver? Is this my gallbladder? But we should not diagnose ourselves. And sometimes, the more you read online, the more you become, definitely it's a good thing to be a knowledgeable patient, and that helps your doctors make good decisions, but don't diagnose yourself. Don't diagnose others. I never diagnose people, even when they come, my own patients. I never diagnose them. If I suspect that there's a bigger issue, I want them to go see their doctors. I understand that at some points the gallbladder has to go, but not all the time. And there are a lot of things that you can do with your diet and your supplements to help your gallbladder work better. My approach is always let's do the least invasive option. Let's work on the diet and lifestyle. But there's always a room for medical interventions if that's necessary. Someone asked, I had a stomach ache for a few weeks. It's awful, and in the blood test it showed that I have H. pylori, and H. pylori is a bacteria that commonly grows in the stomach. What should I eat to help me with the nausea? So, like, for the person who asked this is, are you on medications? Is that going to affect the answer? It's not about eating one thing or taking out another. It's about looking at the diet from a big perspective. Are you eating regular meals? Are you skipping meals? What is the composition of the meals? Too much carbohydrates is definitely going to feed the wrong bacteria or feed bacteria in general. Now, H. pylori, and I talk about this, I don't know if I had the acid video, the heartburn. H. pylori will make you produce less stomach acid, which will make your digestion slower and make your digestion not as optimal. So you might end up with more heartburn or more indigestion and more bloating, and that can be the nausea, can be a sign that you're not digesting food properly. So it's really like when you have a medical condition, it's really hard to give a straightforward answer, because I will do people a disservice if I just give a prescription without knowing the full picture. And as medical providers, this is there's responsibility in there that just getting the whole picture and knowing the whole aspects of the diet and what else is that person dealing with. So thank you so much for watching this. If you have any comments, we'll be monitoring the comments afterwards. If you have stomach pain, or if someone you love and someone you care about has stomach pain, and they've done everything, they've done the scans, they've done the testing, the blood, the stool, the urine, and they're still in pain, and they were told that they have IBS, share this with them, because there's so many people out there who are suffering, so many people who are using medications that may or may not work, cost them more money, that are causing more side effects, and they just don't know that there is a help, and they don't know that there's a solution. So if you know someone who is in this place, or if that is you, comment, write me a note, let me know, and I'm happy to give you a little bit of direction on what you can do. So thank you for you joining us live. I will see you next time. Have a great day.